Hello, everyone. Welcome back with Talk with Terry Tuesday. I am Dr. Scott Terry, here to update you on the latest, the greatest, all the information that you want and need. We're going to do a little bit of housekeeping first. So, this month of October, this is officially Breast Cancer Awareness Month, but a lot of people don't know it is also Menopausal Awareness Month. So we are celebrating both of those events. Go get your mammograms, do your breast exam. Make sure you get that done, even for men who have strong family histories of breast cancer in their family. Go get checked for your breast cancer. Also, we are going to be doing menopausal month. And so we're going to be talking about breast cancer and menopause in this episode. Just a little bit of housekeeping. I'm actually going to be joining a group of women no, I got to read this. So it is November 16th. If you go to Eventbrite, it's TFAC Autumn. So it's the auntie event. So it is going to be talking about it's women between their 30s on up until where we're talking about menopause, what we can do to treat it, what happens, all of the A to Z that's going to go along with. So if you are interested in coming to this, it is November 16th. There are not a lot of tickets left, but Corey Bell, she is a wonderful comedian. She's hilarious. Dr. Lisa Green, they are the people who are putting this on. I'm actually one of the speakers that will be talking about menopause, once again, A to Z. And then we have some other young physicians and practitioners who will also be joining and talking about everything. So get your questions answered. There will be a mimosa that's a part of it. There will be some different events that you can actually partake in. So it's going to be exciting. It's going to be fun. We did it last month and it was a great turnout. And it's just information that we want to make sure that everyone has access to. So, what else are we doing this month? This is October. So, November 20th. So, this is next month. We'll be reminding people every month. We are also doing the Men's Health and Wellness event. So my husband, Jason Terry, is the person that kind of handles and sponsors that. It's an all-male panel. It's an all-male group. So there are no women allowed. Women, you can drop your husbands off and come back and pick them up. But it is also an A to Z presentation. There's no, um, you don't have to feel anxious about asking questions. We have it where you can write your question down, put it in a basket. I'm not even in the meeting for the majority of it. It's our event that we put on, but it is specifically meant for men because we want to make sure that you know what's healthy, what's not, what's the normal process, what testing you should be getting. If you're not getting certain tests, things that you should be asking for from your doctor. But we want to make sure that you are healthy as well. So, if you have questions or concerns, or you want to sign up for any of those things, once again, you can go to Eventbrite for the Fly Aunties Club. That is who's presenting the menopausal event on November 16th. That's a Sunday. And so if you go to Eventbrite, you can see if there are tickets left, they're going quickly. So I would say today, if you want to go, then you probably should get your ticket today. And for the men's event, give us a call here if you want to sign up for that. And that's November the 20th. And we'll give you all the numbers, the information to contact us so that you can secure your spot. Okay, breast cancer and menopause. So, number one, what I tell people is that if you have a strong family history, even if you don't, um, you should have your breast cancer screening performed. Most of the time, people, when they go see their gynecologist or even their primary care doctor, They'll do a breast exam to make sure everything looks okay, or feels okay, but we can't always feel everything. So we recommend doing mammograms. There are different recommendations. So I usually tell people between 35 and 40 get a baseline mammogram. After 40, I usually suggest doing once a year. Breast cancer is increasing, it's on the rise. Part of that is because of dietary changes that are going on, and we'll dive a little bit more into that. But we can also detect breast cancer at a much earlier stage when you're getting the screening done. So one of the things I tell people, if you have a strong family history of breast cancer, so women who are diagnosed in their 40s, and they're your aunt, your mother, your grandmother, they're diagnosed early, especially like I said, below 50, that may increase your risk. And so I'll even suggest to people to do genetic testing. There are some tests that are offered. One is called the BRCA testing. So BRCA, it's a gene that has shown that it actually increases your risk of breast cancer if you are positive for certain genes. So family history is something that we have to talk about. A lot of times people don't know because everything has been kind of hushed. Nobody talked about it. But if you know that you have a strong family history, that is something that you should definitely be getting screened for. I have some patients who are just opposed to getting mammograms. If you are one of those patients, I still suggest certain screening. There is one called a thermogram. It works a little differently. It works by detecting increase in blood flow or heat or energy in a certain area. So it's not something that is going to kind of compress the tissue, because there are some people who are concerned about having their tissue compressed. There's a thermogram that they can do if you're just not going to have a mammogram done. Mammogram is actually the gold standard, but if you are just refusing to have a mammogram done, then consider doing the thermogram. It is going, so if there's a lot of blood flow going to a particular area, that's something that's a little bit more concerning. It's not diagnostic. You still have to actually have a biopsy done, but that may give you another screening tool if you are opposed to doing the mammogram. The other thing that I would tell people is that um, your diet, sugar, carbs, alcohol, especially someone who's had breast cancer, all of those things are going to be inflammatory. And I strongly urge people to really watch the intake of those particular items. Anything that's going to cause more inflammation is not something that anyone who's had cancer should actually be doing. So, cutting back on the bread, the pasta, the rice, the juice, the soda, all of those things, cooking more, increasing your protein intake, such as meat, so fish, chicken, all of those things will help and decrease your chances of getting breast cancer. Exercising, all of those things actually help decrease those chances. So we're also offering, if you have had your mammogram, because we are strongly urging people to get the screening done. If you've had your mammogram, or for those who don't want to do a mammogram, then you've done a thermogram, we are giving you $25 off of any service for this month, as long as you bring in a copy of your results or show us a copy that you've had it done within a 12-month period. Now, moving on to menopause, because this is also menopause month. Um, what I tell people is menopause symptoms vary depending on each individual person. There are some people who, one of the big things that people talk about is the hot flashes, the mood irritability, the not sleeping. Those are some of the main things people actually talk about. Average age in the United States for menopause is 52. So there are some people who start to go through menopause in their mid 40s, early 40s. There are some who are 55, 56 who are going through menopause. The definition of menopause is you don't have a cycle for 12 months in a row. So if you've had a cycle, it's been 9 months. On the 10th month, you have a cycle, you have to start that whole 12-month calendar all over again. So that is the official definition of menopause. If you are getting a blood test, something called an FSH, it's called follicular stimulating hormone. If that is elevated above 25 or 30, then chances are high that you are also in menopause. Now, there's this area, it's a gray zone that's called perimenopause. You're not quite in menopause, but you're starting to have a lot of symptoms. What are those symptoms? It could be increase in anxiety. It could be the fogginess. It could be joint pain. It could be urinary urgency. It could be what? Mood irritability, depression, low libido. All of those things can be related and start in your 40s. And those are more perimenopausal symptoms. What I tell people is that when we look at menopause for long periods of time, we only talked about estrogen when we talked with women about how to treat some of the symptoms. But what I discuss with all my patients, and we've been doing this for probably almost 12, 15 years, is that everyone, women and men, make testosterone and estrogen. So for women, our testosterone level is going to be half from the age of 20 to the age of 40. You will have half of your testosterone level. Testosterone receptors are on every cell in your body. So that's why people start to have changes that affect every organ in their body. Skin changes, visual changes, bladder changes. Those hormonal changes will have an effect on you. I've had some people who they were like, is something going on? Am I going through dementia? Because I just can't remember. That was one of my biggest things was the mental fogginess. I would be talking to someone and couldn't come up with simple words. I've had people who they've walked into a room and can't remember why they walked in there. They're in meetings and they just start pouring down with perspiration and sweat. And those things actually cause a lot of disruption. It causes a lot of frustration, and it can, for some people, it actually affects their marriage and their relationships with other people. So, what I tell people, there are things that can be done. And, we try to go through the whole gamut, including your diet, including exercise, including things you can do over the counter, including getting your sleep. There's so many aspects of this. Everyone is not going to experience the same thing. I do tell people you've got to make sure diet and exercising is on the list. Yes, we can give you hormones, we can give you prescription medication, we can give you all of those things, but we also want to make sure that your total well being is improving, not just you have a little bit better libido. We want to make sure that you can think through things, that you can sleep at night, that you're not up all night going to the bathroom with urgency. So there's so many different aspects. We're going to be doing menopause and other series throughout the year. We want people to know the information. And so people will ask me, well, why didn't my gynecologist talk to me about certain things like testosterone? What I tell people is that as a medical physician, we have not had a lot of training in medical school and residency in alternative therapy on things that are more natural. We've had some, but not a whole lot. And so my goal is to make sure you have all of the information, medications, lifestyle changes, bioidentical hormones, which are natural hormones. So you know what the whole gamut is. You're not just dealing with one. Vaginal dryness. If you're someone who's had breast cancer and your doctor has told you you cannot be on any type of hormones, there are things that you could do. There are vaginal lubrications. There are vaginal moisturizers, which are two different things. A lubrication is something that you're going to use during intercourse. The moisturizer you're going to use 2 to 3 times a week, whether you're sexually active or not. There are vaginal rejuvenation procedures that don't require any downtime and it's non-hormonal, but you're still able to enjoy the intimacy with your partner because you're someone who can't take hormones. So there are so many different options, so many different aspects. I am glad that we are talking about this a lot more. I'm seeing different venues and different things pop up about menopause. It's something that has been lacking for a long time. We've been talking about it for a while, but I'm glad that more people are joining this conversation because we're all going to experience some aspect of it. And if you know in your 30s, well, I'm not going to be miserable because I can do this. You know that there are things that you can actually do. Menopause doesn't have to be a death sentence. It can actually and should be the best time of your life. Kids are gone. You and your husband can go out, and your partner can go out and hang out. You don't have to hurry back to make sure that the babysitter is relieved. So, this is the time that you've established your career, you have gone through all those different changes, and you probably need a little bit more energy and a little bit extra because now you're dealing with college age kids or grown kids or grandkids or parents. You need that little extra energy to keep your sanity, to keep your mental clarity, and all of those things. So remember, Breast Cancer Month and Menopausal Month. Help your neighbor. Let them know that there are things out there that they should be getting screened for, and there are things that are out there that they can do to help them through this next phase in our lives. So, if there are questions, okay, she's shaking her head. I guess there's a lot of questions.
Yes,
Okay.
yes, there are. A question came in earlier. Do I still need to have pap smears, mammograms, or annual checkups if I've gone through menopause already?
You absolutely do. So, with mammograms, the risk for breast cancer increases with age. So we definitely want to make sure that you are getting your routine mammogram. Pap smears, generally, everybody, so it's situational. If you've had a hysterectomy and you have not had any abnormal pap smears in the past, then you technically do not actually need the pap smear test. You do need to have a pelvic exam by your doctor every year. If you have Medicare, they won't let you see a gynecologist every year, but they will let you see them every 2 years. But yes, you still need to have those exams. Everybody 45 years and up should have had a colonoscopy or is having a colonoscopy. It's not colon cancer month, but since we're talking about those things, the rate of colon cancer has significantly increased over the last several years. It used to be we started screening at 50. We are now screening at 45 because the rate has significantly gone up, which goes back to your diet and exercise. We can't get past it. You've got to work on and know what you're eating, how you're eating, and what's in it because there's a lot of different chemicals that are being put in some of the foods to preserve it for longer. Um, we have to make some changes in all of that. But yes, you should still get your pap smear, um, mammogram, colonoscopy, screening labs. If you're having certain symptoms, even for women, even men, everyone doesn't check your testosterone level. You have to ask. So if you're having a lot of these symptoms, then once again, you may not be completely menopausal because you're still getting a cycle, but you're having these symptoms. And you're like, well, what am I supposed to do? Because I'm not menopausal yet. There are things that you can do. Okay.
On Facebook, Donna F underscore 65 asked the question, do I need pap smear after partial hysterectomy? I have one ovary left.
If you do not have a cervix, because that's what the pap smear is screening for. The pap smear is screening for cervical cancer and what the risks are. So if you do not have a cervix, so there are different ways to do a hysterectomy. Some people will just take everything except the ovaries. Um, some people will leave your cervix and take the uterus. So if you still have a cervix, then yes, you still need pap smears. If they have removed your uterus and cervix and you have never had an abnormal pap smear, then generally, no, you don't necessarily need to have an actual pap smear test.
Okay. There are a couple more questions.
Okay.
Since I've started menopause, I've had dryness which causes pain. What can I do to reverse this?
So there are a variety of things that can be done. We talked about the vaginal lubrication, and that's something that you're going to use, whether or not you're going to use the lubrication when you're sexually active. The moisturizers is what you will use whether you're sexually active or not. And there are different types of moisturizers. There is Replens, that's over the counter. There's Reverie, that's something you can order online. What they do is they actually help bring moisture into the vagina. So you don't have as much of the dryness, but you have to do those inserts at least 2 to 3 times a week. There is vaginal rejuvenation. So there's a laser that you could do. There's radio frequency, there's ultrasound. So there's multiple types of vaginal rejuvenation. That's a procedure. Generally, it is not covered by insurance because they consider it cosmetic. But what I tell people is that if you have a health savings account and you're having pain with intercourse or vaginal dryness, you could use your health savings account to have one of those procedures done because what it does is increases the vascularity in the area. It changes the tissue so that the collagen, it builds more collagen so the tissue is not as thin. And so it helps significantly with orgasms. It helps with the vaginal tissue so you don't have pain with intercourse. It helps with urinary symptoms because the bladder sits right above the vagina. And so it'll help those people who may have more urgency and sometimes a little bit of leaking. Doesn't completely resolve leaking, but it will, for a lot of times, help with urinary symptoms. There's also hormones that you can take. There's estrogen hormones that you could do vaginally. Most of the insurance companies will cover prescription estrogen. There's also testosterone that people will do as well. And then there's some other vaginal inserts that you can do. But there are different things that you can do. You just need to actually have a consultation just because we would need to go through your whole history and make sure that you're a candidate for whichever choice you want to proceed with.
Okay. You just answered that question, which Ramoniak did ask, which vaginal moisturizer do you recommend? And you just answered that question. And then back on Facebook, the question is, the results of my mammogram always say that I have dense breasts. What does that mean in terms of the accuracy of the test results?
So it it technically gives because when you have denser breasts, it can sometimes be a little bit harder to see certain things. So it is a way of covering, you know, for risk of being sued that something was missed. But usually, if someone has dense breast tissue, they're still able to see abnormalities. If you are someone who has a family history, sometimes they actually suggest doing MRIs alternating with diagnostic mammogram. So it doesn't mean that you are at a higher risk. It just means that the tissue is just denser and it's harder for those x-ray beams to penetrate through, but it doesn't increase your risk or indicate that you have a higher risk of breast cancer.
Okay. And just a few comments. April had said earlier when you were talking about uh, the one of your topics that's me.
Okay.
That was April. So she was on Facebook. And then Lanita says, thank you for this platform. And then Chloe on Instagram, very pretty, so pretty, Dr. T.
That's my daughter. So once again, we do these podcasts so that we can share information, and we try to do it in a setting that's not so stuffy, that is not so intimidating. so that you're able to ask your questions, and get some information out of it. And even if you're not going through it, you may know people who are, and people suffer. And we just want people to have the different options of actually being able to feel like yourself again, me included. So um, those are just the topics that we're talking about for this month, for the month of October. So remember, even younger people, if your parents, your grandparents, if they're having a moment, just hug them and tell them it's going to be okay, and then refer them to see me, and we'll take care of it. And so we all know someone who needs. So once again, just the information that we're giving, if you know someone who needs the information, pass it on to them. You can always schedule a consultation with us or your own gynecologist. If you want to contact us, you can contact us via phone 708-864-4988. You can go to our website, allurelasermedspa.com. You can come see us at 7151 183rd Street. That's in Tinley Park. But we enjoy making sure that our listeners are updated and know all the latest and greatest information. So once again, if you have any questions, you can also contact via Facebook and LinkedIn and Instagram and all those. We're on all the platforms. Okay.
Yes.
So
You had one last comment,
okay.
and that is from April. And she says, "Thank you for this info. Beautiful."
You are so welcome. Just share it with other people. Go get your mammogram if you have not done it. It's every year. If you're over 40, go get your colonoscopy if you have not done it and you are over 45, or you're having some type of bowel complaints. And if you're having a lot of menopausal symptoms, whether or not you are in menopause and not had a cycle in 12 months or not, but if your symptoms are present and it is affecting your life, contact myself or your gynecologist. Okay, we will see you next month. We hope you have a wonderful Halloween that's coming up. Thanksgiving will be around the corner, and then it'll be Christmas. So enjoy these last couple of decent warm days. Talk to you later. Bye bye.